In this next part of the talk, I will be talking about insurance and reimbursement. The objectives of this portion of the talk are that the learner will be able to recognize reimbursement policies for New York State. They'll be able to understand Medicare coverage and payment for virtual services, and they'll be able to explain the difference between coverage parity and payment parity. So, with insurance and reimbursement, it is very complex. There are many types of regulations, and it is covered, there are regulations that are federal, there are regulations that are state, so that is something that makes this very complicated. Insurance and reimbursement has traditionally been a barrier to the greater acceptance of telemedicine before the COVID-19 pandemic. And the reason that is because, as we saw before, there's a complex mix of federal and state laws that govern reimbursement. And state laws vary a great deal in regards to reimbursement. Telemedicine reimbursement rates are also often lower for telemedicine versus in-person visits. This is called a lack of payment parity. So let me talk a little bit about what coverage parity is as compared to payment parity. Coverage parity requires that insurers provide reimbursement for telehealth. There are 41 states back in 2019, 41 states and the District of Columbia that required coverage parity for telemedicine. Payment parity, on the other hand, requires insurers to provide reimbursement at the same rate as in-person services. So there are much fewer states in 2019 who had payment parity. There were only about 6 to 10 states in 2019 that had payment parity. During the COVID-19 pandemic, there have been more and more states that are now requiring coverage and payment parity. If you look at the most recent data, and this is changing, but there are now about 17 states that require both coverage and payment parity. There are also many private insurers that are now voluntarily increasing coverage parity for telemedicine, whereas perhaps they may have not covered it in the past, although they're not necessarily increasing payment parity rates. I wanted to talk a little bit about Medicare coverage. So prior to the COVID-19 public health emergency, reimbursement for telehealth services was provided only under very strict conditions. Some of those conditions were that the patient had to live in a rural area in order to receive telehealth services. The other condition was that patients had to go to an eligible facility to receive telehealth services, usually like a specific hospital. The telehealth service had to be conducted via synchronous live video format, and there had to be a pre-existing relationship between the provider and the patient before a telemedicine visit would be reimbursed. So during COVID-19, a lot of things have changed in regards to Medicare reimbursement. So they have loosened a lot of those restrictions. So for example, they are now allowing beneficiaries to live in any geographic area to receive telehealth services. They are also allowing beneficiaries to receive services in their home, so they no longer have to go to a hospital. They are removing the requirement for pre-existing relationships between the patient and the provider. So that is great. You can see a patient for the first time using telemedicine. And they're also allowing some services to be delivered via audio-only phone. So you can actually just reimburse for a phone call between the patient and the provider.